Welcome to another episode of the Abundant Wellness Podcast. We have a wonderful guest with us today that I'm so excited to chat about, and I think is just going to bring a wealth of information to all of you who are listening. We have Andrea Ippolito here with us. She is the founder and CEO of SimpliFed, and I'm going to let her share all about what that is and why that matters for motherhood and the broader healthcare experience overall. So, Andrea, would you share a little bit with us about who you are? And I know we talked briefly about your background, but also share with our listeners what kind of got you to the place that you are in, becoming the founder and CEO of SimpliFed.
Well, thanks so much for having me. So happy to share a tiny bit about my background and what led me to founding SimpliFed. One of the things that I'm very proud to talk about as part of the founding journey is that, my first daughter inspired SimpliFed, but my third daughter and I became patients on the platform. And our journey started off as, I'm a biomedical engineer by training. My background is I designed virtual care systems and researched them when I was a graduate student for the chairman of the Joint Chiefs of Staff in the military. And so I understand how to use virtual care as a way to really improve access to care, especially for those that are underserved or where there's unmet needs in the market. Also co-founded my first company out of grad school. So that gave me experience in founding a company to really tackle access issues. With that first company, we predicted no-shows to medical practices so that we could then reach out to the patients, get them scheduled, get them in. And then fast forward, I worked for the Department of Veterans Affairs, where I led a large innovation initiative. But then fast forward, had my first daughter, and my first daughter was born a little bit early, not too early, but early enough that she was born underweight. And I live in an area which is actually pretty rural, but interestingly enough, has the highest density of lactation consultants.
Really?
A place called Ithaca, New York.
Wow.
It's an academic town. It also has the highest density of commercial health plan coverage because you have this large academic institution in the area. So most folks are employed by the university here. And so because of that, we actually have really strong maternal health care coverage here. And even though we have that strong maternal health coverage, when my daughter was born, I was just shocked. And I felt so like I didn't have enough support. I felt like the postpartum period was just a vacuum, and you had this very major medical procedure of giving birth.
Right.
And I said, my daughter was born underweight, and I thought, holy moly, no one really prepared me for the postpartum experience. And in particular, no one really prepared me for what breastfeeding and baby feeding would look like. And I felt so lost and confused. I was in so much pain, and my daughter also kept dropping weight, and that's a really scary place to be.
Very scary.
Yeah, and it's your first job as a parent, right? To grow, your baby to gain weight
Right.
and feel like a failure. And as I, experienced this, and ultimately, everything ended up being fine with my daughter, but I just felt like the postpartum experience was just such a slog and painful. And I had preeclampsia, just like a lot of women these days. And I thought there's got to be a better way. And so started looking into this arena, and I learned that under the Affordable Care Act, health plans are required to cover breastfeeding and baby feeding support. And I learned that most health plans aren't compliant with that policy. I also learned that there's these board certified health professionals, lactation consultants that are out there that are supposed to be covered under insurance. And then I learned that, there were a lot of moms that felt like I felt, and that there needed to be more support, and that there was also reimbursement code. So all the plain parts were here to really design a virtual care system in particular that could really reach families in their homes. And whether you live in a rural area like me or an urban area or suburban, you don't want to have to bring your, newborn nugget over to another clinic.
Right. Well, going anywhere, I feel like it takes so much mental planning, because you're like, okay, I fed them. They're probably going to poop in 10 minutes. And then I'm going to have to change the diaper. And then we've got like a 30-minute window, maybe, before they're hungry again. Right? And I can't be driving during that time, because driving with a screaming baby is like the worst, most stressful experience. So it is like, it's a circus trying to go anywhere just with even just one baby at the very beginning. And especially when I think you hit the nail on the head when they're brand spanking new and they're underweight. You know, my baby was about 3 weeks early, my youngest, and not terribly underweight, but there was a level of hypervigilance with her that I did not have with my firstborn, who was born on time, chunky, full. You know what I mean? I was like, okay, we can go for longer stretches of time. When they're underweight, there is just a level of anxiety that you have around that aspect of, you know, there's more pressure, as if you didn't already feel enough pressure being a brand new parent, right? So you have this background in innovation, building systems. And then you had this experience that helped you to really like feel, it was like this felt gap, right? Not just in like, I know knowledge wise that there's a gap here, but like you felt the gap. So tell us, what were some of the problems that you observed bringing both of those back, you know, those experiences together that really led you to creating this platform called SimpliFed?
Yeah, well, I love how you asked that, because they really are in these two categories. One is on the patient experience and like literal and figurative pain point side from the patient perspective. But then I saw that systemically there were some opportunities / pain points. So let's start on the patient side. So on the patient side, like I said, I lived in an area with great maternal health care coverage. We have just in general great support in my county, considering we are in a rural area. Highest density of lactation consultants. There's access to doulas. The OBs have very favorable outcomes. They're part of this community. You know who they are. They're supportive. And I was able to have, you know, a great prenatal experience. And then my daughter was born, and I saw that breastfeeding and baby feeding support. Breastfeeding was my goal. Just one other quick side note: at SimpliFed, we're very supportive, no matter how you choose to feed your baby. But
for you, that was your goal. Yes.
But for me, that was my goal. And you know, baby's born, you're handed this newborn nugget, and no one told me what to expect. So that was the first major pain point I saw. And then you talk to your colleagues, you do the research and on the customer side, and you realize this was a lot of people's experience. That you know, you're given the baby, and your first job is, you would think, to recover, but your first job is, I literally hand you baby, if breastfeeding is part of your goals, all right, let's feed the baby. And no one had prepared me for that experience. And you have this organ that you've never used in this capacity before. You're recovering from this very major procedure, and you're expected to feed it, and no one has taught you and prepared you for this. No one has told you that milk takes often 2 to 5 days to come in. No one has told you that it's droplets at first. And so your expectations are just so misaligned. And I actually thought I was failing, which there were pieces of it that, you know, my baby was continuously dropping weight. And that's where, you know, that was the lagging, that was stress and the lagging indicator. But someone should have told me that actually it's droplets at first, and that's normal. Because if no one's told you that, you think you're really failing before you've had a chance to succeed. And then you take the baby home, and if no one is working with you on positioning and latching, or pain, you know, you're in a lot of pain, and you shouldn't be, right? You have two patients here, a mom and a baby, and what I've heard from so many is that it's just it's natural, quote unquote, but nothing's really natural about it. And then, you know, those are the first couple weeks, and you're trying to sleep and recover, but you can't sleep because the baby's waking up. And so what does sleeping and feeding look like? And so how to use your pump. This is a medical device after all. And what the literature now says, that I didn't know at the time, is that most people are using their pump incorrectly or don't have the right flange sizes, and that can cause more pain or not able to use it. And then you go transition back to work and you're trying to figure out bottle feeding, what have you. And all along the way, there's all these evidence-based practices that can be done to help support a mom and baby diet together. But yet it is largely absent from the postpartum experience.
Absolutely. Yep.
So that's one of the major, you know, little pain points, literal and figuratively, that I was seeing from the patient side. And then from the system side, what I learned is that Breastfeeding support is identified as a preventative service under the United States Preventative Service Task Force guidelines and Women Preventative Service initiatives. And once you have identification by, frankly, either of those, but actually both of them, meant that under the Affordable Care Act, health plans are required to cover these services at no cost to families. No copay, no coinsurance. And so
that's amazing. I actually did not know that. And I not to interrupt your flow of thought here, but I didn't know that. I think because I work primarily with women and children in my practice. And so much of what I hear is we were given one lactation visit or two, like at the most, right? One in the hospital and then one in a follow-up, unless you have a doula or a postpartum care practitioner that you've paid for out of pocket, that they're not getting those needs met. And so is there a gap between, it sounds like there's a gap between what the insurance companies are required to do by law and what they're actually telling the consumer. And so then the consumer doesn't know what they can advocate for. Is that part of what's happening?
That's a part of it. The other part of it is that in health plan coverage, when something is mandated like this, often what happens, and this is on the systemic side, is that no one's defined what's called network adequacy, meaning, so this is a required service under these guidelines. But what does network adequacy mean? Meaning how many providers is what each health plan is required to have.
Yeah.
And so if no one has defined that, then it's gray. And breastfeeding and baby feeding support is such a central part of the postpartum experience, but yet you often don't see that strong return on investment that health plans often require. So this is why it needs network adequacy. A, needs to be defined, but B, a lot of what us in maternal health are trying to do is show the direct return on investment that actually investing in breastfeeding and baby feeding support does in the near term, right? We know that there's long-term great impacts in the literature, study this, and there's some questions about that literature, but there is evidence that shows this. So a lot of what we do at SimpliFed is to show that near-term return on investment. And that includes that breastfeeding and baby feeding support. By actually surging support, you can help reduce rates of mastitis, which is one of the primary reasons why folks on the mom's health side are presenting to the ER or urgent care.
Yeah, right.
If those mastitis evolves, that can evolve into a abscess, which requires surgery. So that's an example there. Secondly, on the baby side, and this is what my daughter was at risk for in those early days, is then bilirubin levels can rise or dehydration occurs. And that also is one of the primary reasons for readmissions, which is a quality measure. But frankly, the thing that we are most focused on right now is SimpliFed, and happy to share more on what we do, is that breastfeeding and baby feeding support is almost the chassis for helping to surge support to mom postpartum. And what we're doing along the way, along with providing evidence-based support, is then doing maternal mental health screening and then connection to care. 25% of moms right now are diagnosed with postpartum depression or anxiety, and yet we're not connecting them to care. And barring any large, complex, adverse medical issues, that is the number one cost driver for health plans postpartum.
Wow.
We're doing all sorts of other screenings related to other rising and high-risk conditions like preeclampsia, gestational diabetes. We're doing social determinative health screenings. We're doing urgent care visits, so those will start in a little bit. But essentially, we're leveraging this relationship that we have with families with breastfeeding and baby feeding support to help screen and identify other rising risk issues, which are largely missing from the existing postpartum experience, but also result in some of the major cost drivers for health plans. So
wow,
it's not enough that this is a mandated service. We have to show the return on investment for better or worse. And if we do that, then that helps get better reimbursement for maternal health more broadly.
I love that we're talking about this, because I think from the patient side of things, it can feel so much like, why does it matter? If the, like, why does it matter to prove that? Like, I'm a human, you should be taking care of me, right? Like, that is the human experience. And it's, so what I hear you saying is, yes, of course, absolutely. Now let's prove it. let's prove it to them that this is actually a need that we can support. And so building systems, and this is the part that I want listeners to understand, as somebody who worked in the conventional healthcare system for 15 plus years, that we need to build systems that do both, and that do both really well, right? Because if we can prove that there's a need, and we can prove that we can solve the need and prevent future problems and prevent higher costs in the future, because nobody wants to go to the ER for mastitis. I mean, nobody wants to go to the ER for any reason, but I don't know if you've sat in an ER recently. It is not a fun experience, right? Or urgent care, for that matter. It's stressful. It's, you're putting yourself at increased risk by being there for different things. So I love that what you've built has helped to bridge the gap, but you're doing it so that both parties can communicate. Like, we're solving both needs here, but we have to speak the same language here in order to do that. So at least that's how I interpret what you're saying. So can you tell us more, like, what does SimpliFed do? How does the platform work? How do you support families within that platform?
Yeah, absolutely. So SimpliFed is a maternal care at home platform that to date has been very centered on virtual breastfeeding and baby feeding support. We start working with families during pregnancy and continue working with them in an ongoing longitudinal way postpartum to navigate all the twists and turns of feeding. And there's three main enablers of the work we do. Well, first off, we have an incredible network of evidence-based providers. And they work with families, build a relationship. As I mentioned, my first daughter is inspiration. My third daughter and I are patients on the platform. And so I have been the beneficiary of our services. And I always like to say, my first daughter, I didn't reach my baby feeding goals, had preeclampsia. My second daughter, I didn't reach my baby feeding goals and had anemia. And my third daughter, I reached my baby feeding goals, exceeded them, in fact, didn't have preeclampsia and didn't have anemia. And I think that's
awesome,
because of, I was actually getting timely support. And
right.
And my providers are asking me, hey, did you take your baby aspirin pill for preeclampsia? Hey,
right.
are you taking your iron supplement? And how's your nutrition related to that? And so it really validated our hypotheses that if you actually surge support, you can understand what's happening, not just with baby feeding, but help support the broader maternal health care experience. So that's one enabler, is our incredible providers. And the key aspect is that it's fully covered by insurance. We have contracts with most major payers, all the big ones you can think of. We serve Medicaid beneficiaries, not in all states, but many. And then we serve all TRICARE beneficiaries, which military families represent about 3% of all births in the U.S. Not many people know that, but because I worked with the military health system in VA, I always like to highlight that. Second big enabler of what we do is while you can come to our website direct to consumer, and I highly encourage everyone to do that, SimpliFed.com. You can come in and we'll get you an appointment same day, within an hour even, for those urgent care needs. But the main way that patients find us is actually through their OB-GYNs. And
really? That's awesome.
Yeah, and women's health nurse practitioners and midwives, they'll refer to us typically after that 28-week prenatal appointment, sometimes as early as 20 weeks. And then we do 1 to 3 prenatal appointments, do a lot of expectation setting. And then after baby's born, we continue working with them postpartum. And then along the way, we're sharing our care plan and notes back to OBs. We also work with other strategic partners who refer to us. But the key thing is that we want to meet families where they're at, is that we know a lot of people, and myself were included, don't know that they have access to this insurance covered support. And so the best way we can grow and make families aware of this is by working with OBs. So by the way, if you're working with your OB or midwife or whoever is your care provider, feel free to reach out to us, come to our website, and we'd love to chat with them, because the key thing we try to do is make it easy for them to refer to us. We get embedded as part of their order set, so that way It's not an extra thing they have to do. And so we've built our own homegrown, very secure SOC Type 2 compliant system that's interoperable with all the major electronic medical record vendors. So that's been the key, and that's the third actually arm of what we've built, is we've built our own technology platform, which allows us to really develop processes and systems, patient engagement approaches that really help meet families where they're at. So that's our that's our platform. And then along with providing breastfeeding, baby feeding support fully covered by insurance, we now do maternal mental health screening. And we're doing these other screenings so that we can identify issues proactively, especially postpartum, where we know there's often a lack of care. But I do want to address your point, which you described so thoughtfully, is that I think one of the challenges we always face in women's health, and we see this in maternal health as a subset of women's health, is that often women's health is thought of as this philanthropy. It's the right thing to do. I'm exactly what you said, I'm a human. Unfortunately, first off, we know there's a giant return on investment. Women, we are 80% of consumer spending. We're 51% of the population. We're the chief medical officers of our household. And we also know that in order for us to really show the value, we can't just be seen as preventative or philanthropy. We have to show the return on investment. And
absolutely,
what I always like to say here is that pregnancy is such a stress test on your body. And you get glimpses of what's to come. And there's more and more literature coming out about this. And that's what I saw with my preeclampsia and my anemia. I was recently diagnosed with ulcerative colitis, which that anemia was actually an early signal of that postpartum.
Right. GI issues, right.
Yes. And so if we actually can understand what's happening during pregnancy, we can actually prevent issues from escalating further down the line. And so let's take this stress test as a gift, so to speak, and it gives this sneak preview of what's to come so that we can proactively address. That can lead to better women's health proactively over time and longitudinally, but also can reduce costs in the entire system. So, which is a win-win together.
Absolutely. No, and I love that you mentioned that, because so often we think about these periods of our life, like pre-pregnancy, pregnancy, postpartum, perimenopause, as like these separate sections of our life, when it's all this string that's connected, right? And it's all information that is useful to tell us, is there a signal that's happening here that's actually giving me a clue about something I'm at risk for in the future, or something that I need to be taking care of, because how you experience pregnancy and postpartum is an indicator for how your body handles stress, how your body handles hormone shifts, how your nervous system is doing, how healthy you are overall. So I love that you tied that together. This is not a season of your life to be neglected or even thought of as something that's separate from the whole. It's a part of that whole picture there. So are there any current barriers to coverage that you're troubleshooting? Because it sounds like if there's universal coverage, there shouldn't really be any barriers, but are you finding any barriers between providers and the system that you've built and getting coverage? I'm just kind of curious about, or barriers even to clients getting care.
Well, I'm going to answer it in two parts, because the one, it just helps shed context on how I'm going to answer. So what's really exciting in maternal health right now, and patients might not be aware of what's happening, is American College of Obstetricians recently shared that the last April, it actually starts with that they came out with the first major update to maternal health guidelines since 1930.
What?
Which is bonkers.
Insane. Almost 100 years. No problem.
100 years. And in these clinical consensus recommendations, they call for really thinking about how we can do comprehensive prenatal assessments to really understand some of the risk factors and then design a prenatal and postpartum care experience aligned to those risk factors. And they said, in order to do this right, we have to improve access to virtual care, because while we would love to do all appointments in person, that is just not feasible for all the things we talked about up front. So that was like part one. And then American Medical Association, which is I don't know if they would frame it this way, but they really are the owners of all reimbursement codes and help set reimbursement codes for they announced the elimination of the global maternity reimbursement bundle. So what I wasn't aware as a patient is all of your prenatal, postpartum, labor, delivery care actually is under one global payment, which actually is a very thoughtful idea. And the idea is that you should get all the care you need under one payment. OBs get paid for, the hospital gets paid for out of this, and that way it's just this one payment. What unfortunately happens is that it leads to a lack of care postpartum, and that's why we see this vacuum of care postpartum, is because your OBs, we live in what's called a fee-for-service healthcare world, right? And if you can't get paid for more there, this leads to this lack of care, and especially in light of growing OB provider shortages. So what AMA, in partnership with others, have been doing a lot of research. How can we improve this? How could we get to the bottom of this? There are a few other driving factors there. And what they have voted to, and will be going live January 1 of next year, but starting to actually, in preparation for that, fall of 2026, is unbundle that global maternity reimbursement payment. So all prenatal, labor and delivery, and postpartum care will be paid just like a lot of other healthcare services are paid, in a fee-for-service way, meaning each visit, each intervention will get paid. I think this is a very positive thing. I think this is a positive thing because it will allow OBs to get paid for all the services and midwives as well, of course, to be paid for all the services they're delivering. And I think it will help fill some of the postpartum care gaps. Absolutely. So I'm sharing that as context is it's not necessarily challenges we're facing, but we're entering this kind of brave new world, so to speak, of what this care pathway looks like. But secondly, I think from a macro perspective, health plans, I was just reading some work over the weekend that, many very reputable commercial health plans are not able to have a positive operating profit right now. And that is very problematic. And so what happens is, and it goes back to what we were sharing before, is then they have to really be very picky on who they're letting into their network.
Yep.
And that's very frustrating because this care is so important. So I think across healthcare, not just in maternal health, you're seeing a lot of issues with providers being able to get into health plan networks, which is very hard and frustrating. So showing that return on investment is now more important than ever.
Absolutely. I love the way that you summarize that. That was very helpful. And it helps, I think it helps as the consumer to understand, even what some of the loopholes are, or where the red tape is, so that we can understand, why am I not getting the service that I need, or how do I maybe work with my provider to find ways to access that service, right? Otherwise, we just end up feeling overwhelmed and frustrated and fine, I might as well just figure this out on my own, which is not what we want for anybody to have to do, especially when we have such a beautiful resource available to them. So when somebody goes to SimpliFed, I believe you said that they can access it on their own, direct to consumer, or they can access it through their provider. Do you have to have a provider's order in order to access those services? Tell me a little bit more about that aspect of things.
Thank you so much for asking this. You do not need to have a provider's order. There's no prior authorization needed. And that's the beauty of being this preventative.
I'm clapping and cheering on this site because thank goodness. Oh my gosh, it's such a pain in the butt to have to go that route. So that makes me so happy to hear.
I agree. Fireworks all around.
Yes.
Right? And so that is the current state. I think there are some questions in the unbundling of, what's going to require prior authorization and what's not, but I don't and see us as a breastfeeding and baby feeding support company being impacted because we're a preventative service in that nature. And so, but yes, so that you can come to our website or an OB can refer to us, but no prior authorization or order is needed.
Amazing. That is huge. Because I do, one of the questions I had kind of written down to talk to you about, and we've already chatted about a little bit, is the barriers to care, right? And so as a nurse, I'm always thinking about what are the barriers or the obstacles to receiving the help that people need, right? And so if we can remove that for them, which that's a big one, prior authorization, right? Or having to get a physician's order. And if you're in interim care, right? Or maybe you're done seeing your OB, but you are not yet out of the woods, for lack of a better word, or you've lost, your provider for whatever reason, it's really nice to know that there's kind of a fallback option of like, we just don't even have to jump through that hoop, right? So I know we've talked about a lot today. I'm really honestly so thrilled to hear about this service. I pretty well connected locally to a lot of different maternal care providers. And so I'm excited to share this with them as a resource, but also obviously share it with our listeners. Do you have any, just kind of as we close the session today, do you have any last encouraging words that you would share for our consumers, our listeners? Anything you want to share, honestly. You can take as much time as you want to, because I think you have a lot of really important things to say.
Well, the first thing I'll share is that, really we are not listened to enough, I would say, as patients in the prenatal and postpartum care experience. And I know let's use my example of anemia, I was very fatigued.
Yeah.
Very. And this was my second kiddo. Everyone's tired postpartum, right?
How do you know? Is this normal postpartum tired or is this anemia tired? Right? I don't know. I've never had two kids.
Exactly. And so there was something about it though that I was like, this is bananas.
Next level.
Yeah. Next level. And I was like, I could not drink enough water. I was so fatigued. And so I knew something was up and everyone was trying their darndest to figure out, but turns out my ferritin levels were extremely low and I had to get all these iron supplements and iron infusions as well. And the key thing is that because the maternal health care experience and the current standard of care, especially postpartum, there's such a lack of postpartum care. Mm-hmm. Unfortunately, we as patients have had to be our best advocates. And that's a lot of what we are solving for here at SimpliFed is you meet with our providers. We do a couple of visits prenatally to get to know you, set expectations, and then we work with you for, at least 4 visits, ideally postpartum, if not more, depending on how much your health plan will cover. But these are 30 to 60-minute appointments. We're doing a lot of listening, understand your goals, working with you through your goals. But along the way, we're doing these screenings and assessments so that you are taken seriously. And we are always looking at our outcomes. We recently did a clinical study, and it showed that patients that go through our care pathway versus those that do not have 16 weeks longer breastfeeding duration.
Amazing.
Which we're very proud of because we're very inclusive, no matter how you choose to feed. And secondly, patients that have a mental health diagnosis, which I mentioned is about 25% of women postpartum. Those that have a mental health diagnosis, they have 24 weeks longer breastfeeding duration compared to those that have a mental health diagnosis that did not go through our care pathway. And the one that I think I'm the most proud about is those that have a higher PHQ-9 score, meaning a higher
depression score.
Yeah, exactly, with maternal mental health issues, or the assessment of the potential for that. By the time they go through our care pathway, they have a much lower PHQ-9 score compared to those that
Amazing.
And, what we're seeing, and obviously need to do more work to continue to validate, is that feeding is so tied to mom's mental health. And if we actually support families, then they do better, not just with baby feeding and their goals there, but also from a mental health perspective. And
absolutely,
that's something we're so proud of. And so I'm just obviously a big, always trying to shout from the rooftops, this is something that should be covered by insurance, they should have access to. And we're just so honored to serve families. So come check out our website, www.simplifed.com. And we'd be honored to work with you. And the last thing I'll say is many of us are parents that, and I mentioned I'm a patient on our platform, and we've designed our care pathway so that it meets your needs and it's informed by evidence. We listen to you, and I would say the most common word that patients that do testimonials say is that I feel validated and that I feel confident now. And
I love that.
That is informed by evidence, of course, always. That is just such a, my heart bursting always when I hear that.
That's amazing. And I love, I love statistics myself, and I love data, and I love research, and I love that you're validating the care that you provide with the outcome research, right? And so saying, hey, like, we know this gap is here, but let's prove it, right? And let's show like how much better people feel, how much better families do. Because like you said, if the mom is struggling, if the mom is not doing well, the motivation to do anything hard, right? Anything challenging. It's easy if breastfeeding's easy. That's not going to be a problem. But if you're struggling and breastfeeding's a struggle, it's going to be a problem because the mental health already is not there. And so I love that you're addressing all of those different aspects. For those of you that are listening, you can find the link to SimpliFed in the show notes. I would encourage you to go check it out, share it with a friend, share it with your provider. I think because that's where a huge part of the change is going to come from is in providers being informed that it's a service that's available. Because we do have just those short little appointment times, right, where we have to get a lot of information across in a very short period of time. And your OBGYN can't teach you how to breastfeed, right? They can't necessarily provide the troubleshooting that often is needed, or even how to assess when bottle feeding might be the best option for you or your family, right? And so I love that you guys are bridging the gap on that. It's a service I'm really excited to share, not just with listeners, but with other providers, like I said. So thank you so much for being on the show today, Andrea. I know that this is an incredible resource, and so I'm so thankful for just everything that you've built. But also just the education and the information and being willing to do that groundwork of saying, we're going to do the research on this too, and we're going to show that we have really good outcomes. So I, as a science person myself, as a nurse, I love those data points. So I appreciate you bringing that to the table as well.
Oh, well, I appreciate you. And thank you for all the work that you do. And just so honored to be here with you.
Absolutely. Well, like I said, listeners, I'm going to drop the links to how to follow Andrea and get all of her good information in the show notes. But thank you so much again, Andrea, for being with us today.
Oh, thank you. And have a good rest of your day, everyone.